All righty. Welcome to Rooted Clinical Wellness's November webinar. Our topic for today is thyroid health from a functional medicine perspective. Subtopic, understanding thyroid through an intensive integrative lens, because you observe answers that go deeper than standard lab work. If you'll go to the next slide. Hosting our webinar, as always, is Jennifer Hoskins, my lovely wife, who is a nurse practitioner and founder and practitioner for Rooted Clinical Wellness. Jennifer, as we've talked about in previous webinars, has spent over 20 years as a nurse and over 7 years as a nurse practitioner before moving into the functional wellness space. So with that, I'll turn it over to Jen, and we'll dive into our topic for today, thyroid health.
Okay, thanks, T. Sorry, I'm doing technical stuff over here and trying to maneuver these screens. Let me get this right. Okay, I think that gets us. All right, guys. So thank you for being here tonight. Like I talked about and previewed on the lead up to this meeting, is that we're going to talk about thyroid health today, and basically. Some people know nothing about it. Some people know a lot about it. Depends on how long you may have been dealing with some of these issues. But I really felt like a functional medicine approach really addressed so many more issues than the typical way that we are, tested for the treatment, all of those things in primary care and even in endocrinology. And so I just wanted to this will be a brief overview of how your thyroid works, some of the testing that's required to see if there is a problem with it, and some of the treatment options available as well. So when we look at this first slide, basically, I just wanted to go through and talk about how the thyroid works. It starts actually in your brain. In the hypothalamus, that's the control center for your thyroid, and basically releases another hormone called TRH, and that is a signal to the pituitary gland. The pituitary gland then secretes TSH, which is a thyroid stimulating hormone, and basically what it's doing is trying to wake up the thyroid, and it says, listen, you're not producing enough thyroid hormone, so it then secretes this stimulating hormone, and it makes the thyroid then secrete mostly T4, which is thyroid hormone, and some T3. I'm not going to get into the technicalities of how T4 and T3 work, but just understanding T3 is the active version that our cells can use. And so T4 is what the thyroid gland produces most of, and so it has to then be converted in the liver. Also, the kidneys do a little bit, the brain, muscle tissue, but 80% of T4 is converted in the liver. So it then goes down to the liver. So just looking at this cascade, it makes you realize there can be a problem along several pieces here. And so that's why I like to explain it, just so you kind of understand what we're talking about. Because a problem at any one of those spots can lead to symptoms of either low or high thyroid. Let's see. Okay, so this is just, kind of when the chain breaks. And it's just an idea, again, that dysregulation can occur at any spot. There can be some stressed out signaling in the brain, making things not quite the signals to produce more thyroid hormone not quite go through the way they should. There can be some sluggish conversion in the liver. It could be a receptor problem. So brain's doing right, thyroid's doing right, liver's doing right, but the receptors on the actual cells may have some resistance. So there can be some problems along the way. And so that's really the basis of why a one-size-fits-all approach is not good for most people, and is kind of a broken part of the way we assess for thyroid health. All right, so some of these signs here, this is kind of a lengthy slide, but I wanted to make sure all of these were on here because I'd love for you to read through and just kind of go, hey, does this sound like anything you're dealing with? For a lot of people, low thyroid is probably more common and what people would recognize as far as symptoms. So we talk about persistent fatigue, low energy, weight gain, Some people have some cold intolerance. I hear a lot of people have thinning hair, hair loss, nails aren't great, constipated, depression, brain fog, all of that's there. Of course, with your thyroid being high, you have the other end of the spectrum. And so instead of feeling very low, you're actually very high, leading to anxiety. A lot of people would report irregular heartbeat, palpitations. Sometimes there's weight loss, but that is a later sign. You don't see that right away. You see a lot of sweating, heat intolerance, shaky hands, difficulty getting to sleep, staying asleep, muscle weakness, frequent bowel movements. As you can imagine, these symptoms, and especially if you've been through them, they can profoundly affect your day-to-day living. And so whether you're slow and feel like you're slogging through the mud, or whether it's fast and you feel like you can't calm down, that does not have to be your reality. So when we talk about the conventional approach to how thyroid health is assessed, there's a problem here, because typically what happens is that primary care providers are only testing TSH. Now, some of them will test TSH, and remember that's the thyroid stimulating hormone. And then they'll also test T3 and T4, but not everyone will. Typically, you can get those initial tests done. The problem is, if all they're looking at is a TSH, it's a two-piece problem. So traditional medicine has a very wide range as far as normal. And if you've been with me through any of my other webinars or listened to any of the stuff I've talked about on Facebook, the problem is that wide range of normal is only going to hit into the abnormal and out of range once you're in a disease state. And functional medicine doesn't want to wait till you're in a disease state. We want to make sure that we are catching things so that you don't get to the point where these symptoms are affecting your life, for months and months at a time, that we're actually seeing these things early. So if they're only checking a TSH, that parameter and it varies by lab, but for the most part, it's anywhere from 0.5 all the way up to 4.5 is normal. Well, functional medicine would say that that's not optimal, and our optimal range, which is much more narrow, and it's narrow because we recognize that outside of this narrow range, you're going to feel symptoms. Outside of this normal range, you're going to be getting close to a disease state. So the functional medicine optimal range for TSH is between 1 and 2. Anything outside of that, we realize there is a problem, because your body should be maintaining that level. And so not only are we looking at TSH, but when I'm ordering thyroid labs for a patient, I'm going to order TSH, free T4 and free T3, and I'll explain a little bit about what that is. I'm also going to order the totals on those ones, and we're definitely going to look at antibodies for your thyroid. This gives us such a better look. So when I order these, I order the total T3 and total T4 along with the free, because the difference between those two is that the free T3 and T4 are what is able to be used. And when we talked about how it works, if I don't order TSH, free T3, free T4, totals, and antibodies, I cannot tell at what level there's a breakdown, right? I can make some assumptions, but if I order those from the beginning, and these actually are not very expensive tests, so if I order those from the beginning, we can see where a problem might be. Let's see. All right, so one of the things that I actually have been very fascinated about, and why I have been really excited about doing this webinar, is that there is not everybody, but for a lot of people who have either a low thyroid condition or a high thyroid condition, there is actually an autoimmune component. And so again, when we talk about the labs that I would order just on the front end, I'm always going to order the antibody markers for thyroid. And the reason for that is that we can, and it happens frequently, we can see very clearly if your body has created antibodies towards your thyroid, which may be driving the changes in your thyroid levels. Let me explain a little bit about that. So there's two different antibodies towards your thyroid. They're very specific, but we don't always know just looking at those thyroid levels, whether, at the antibody level, let's try that again. At the antibody levels, we don't know if you're trending towards Hashimoto's or Graves. And the difference between those, basically, there's a lot of difference, and it's complex, but I'll give you the very basic idea, is that Hashimoto's is typically going to lead to hypothyroidism. So it's too low, and you start having all of those symptoms: exhaustion, weight gain, frequent brain fog, versus the whole other side of the spectrum, which can lead to Graves' disease. And so that is hyperthyroid, too much thyroid hormone. And that's going to, again, be that racing heart, the palpitations, anxiety, weight loss, and those sort of things. And so when we look at those, and if you were to have positive antibodies on that antibody test, we really have to, obviously, we're going to evaluate all the levels. And it might even be that I'm going to refer you on to endocrinology, because sometimes that will be needed. But what it tells me just from the get-go is that your immune system has gone into overdrive. It's created antibodies that are actually attacking your thyroid. And so we really, the testing for those antibodies is absolutely essential, to make sure that we slow that attack down or even stop it. That would be the point. And functional medicine is exciting to me, because if these numbers were seen, let's just take a patient who maybe is dealing with low thyroid. And even if you ended up getting the testing for the antibodies, and you were positive on antibodies, the treatment is still going to be, especially by primary care, the treatment is going to be, here's some thyroid, right? Here's some Synthroid levothyroxine, that's T4, and they're going to give you that, and it's going to help the symptoms, right? So your problem is you have low T4, they're going to give you T4, it's going to convert to T3, and we're good. Except that what we're really doing is masking the problem. We're sticking a Band-Aid on it. So we're fixing your symptoms from it. But what we're not fixing is the antibodies that are being created, and they're just attacking your thyroid. And so with functional medicine, we look at it more of like, again, it's a root cause approach. We want to make sure that those antibodies, that the goal would be to stop antibody production and eventually decrease your need for medication. Maybe get off of it totally, maybe not, but at least knowing that if we stop the antibody process, we can save your thyroid gland and save the function. And so that, again, is what excites me being in the functional medicine world of we're not just going to Band-Aid it. We're going to see, okay, what can we do to slow this down, to stop it, to potentially reverse it? So if you know anything about autoimmune conditions, there are several autoimmune conditions that people deal with. We're talking, obviously, we could have some thyroid conditions, but we're also talking about psoriasis, rheumatoid arthritis, MS. There's several things that can happen where basically our body has created antibodies that then attack healthy tissue, and we're symptomatic because of that. Well, there is a lot of evidence, and if you're interested in reading research articles, please hit me up for some of these links, because it's fascinating to me. This is not just within the functional medicine world, but within clinical research as well, that shows there is a very clear connection between autoimmune antibodies, not just those thyroid ones, but any antibodies that we create that are against our tissue, so autoimmune. There's a huge connection between leaky gut and autoimmune conditions. And so, again, just fascinating to me that if we get to that root cause and we go in and we fix the leaky gut problems, we can turn some of these symptoms around. I'm not promising an absolute cure on your autoimmune condition, but what most people see is a real reduction in symptoms. And so let me just talk a little bit about leaky gut and what that is. So, as I've mentioned on here, a healthy gut lining is going to keep the food particles and the toxins from entering the bloodstream. So I use this example all the time when I'm talking to patients. So our gut lining, that should be really tight junctions that are only letting specific nutrients cross that barrier and get into the bloodstream. But what happens with leaky gut is that that barrier kind of breaks down and those junctions open up. And then they start allowing things to enter the bloodstream that our immune system says, hey, whoa, we don't get what this is. We think this is a foreign invader. And then it creates antibodies. It's a good thing. It's what our immune system is supposed to do, except that those antibodies then, and there is a genetic component, not everybody with leaky gut is going to develop an autoimmune condition for sure. But, when those antibodies are formed, they can start attacking our healthy tissue. So the way that we would approach this in functional medicine is basically that when we see an autoimmune condition, if you came to me and we were doing some testing and I saw autoimmune, we could probably assume you have leaky gut. It's present in just about everybody with an autoimmune. But like I said before, the flip side of that is not everybody with leaky gut is going to develop autoimmune. But we can do some advanced testing, some gut health testing, some blood testing that would definitely give us a definitive diagnosis for gut health. I also like to do some testing that kind of looks at the bacterial component, the good bacteria, the bad bacteria in your gut as well, because that can give us some clues as to what led up to the leaky gut problem. But at the end of the day, healing the leaky gut, getting those junctions tight again through supplementation, through diet, through just some changes that you make. People have had some really significant improvements in symptoms. When we talk specifically about thyroid health, you could have a patient who has been on thyroid medication for years, being able to step down just a little bit off of their medicine. And for people who are newly diagnosed, not even having to go the medication route, which is so exciting to me, that you could fix their gut, fix the leaky gut problem, and get them to a point where those antibodies are no longer attacking their thyroid and the thyroid gets back to a place of health and starts producing what it's supposed to. Because again, our body wants to go back to a state of homeostasis, like it wants the normals. And so if we can take away some of the inflammatory responses, in this case, the leaky gut that's creating the antibodies to it, if we can get rid of those problems, a lot of times we can allow our body to heal and hopefully change the need for so much medication, or at least decrease it. And I've got patients who even on medication still not feeling their best. So the hope would be is to really improve those symptoms, just by addressing the root cause. One of the things, before I kind of talk onto this next slide, I do want to talk about a patient that I had recently. It was amazing to me because she came to me with some symptoms, and instead of low thyroid, which we see pretty often, she actually came with some symptoms that really made me suspect that her thyroid was too fast. Symptoms like heart palpitations, shaky hands, anxiety, couldn't sleep. And so we did just those labs that I talked about. We did a TSH, we did T3, we did T4. We did a lot of just a brief look, again, not super expensive testing. But what that showed us was that she had a normal TSH. So again, if we had been looking at just TSH, if we were in primary care and it was just your typical yearly lab work that's done, TSH is usually all that's drawn, not a T3 or T4. So again, this patient, her TSH was normal. So it could have been years before that was actually addressed from a primary care standpoint because everything looked okay. But you dig a little deeper and you start looking. What her labs actually showed was that she had high total and free T4, as well as high total and free T3. And she had very high thyroid antibodies. And so what we were able to look at, what we were able to catch was that she had antibodies that were already attacking her thyroid and causing, in this case, it looks like Graves' disease. Now, I'm not ready to diagnose her with that. We're very early on. But what it tells me is that, again, we have this autoimmune condition that's likely being caused by leaky gut. And so I was excited to catch that as early as we did. Start healing her gut and hopefully turn those symptoms around. Now, in her case, again, we might, I don't disregard that we have specialists in this area. So it may be that she goes to endocrinology for a little bit and they start looking at, do they need to give her something to lessen her thyroid? There is a medication that will turn some thyroid hormone down a little bit. Does she need that right now just to get through this symptomatic phase? And she might, but I'm excited to work on her gut health and really see if we can turn some things around for her so that her everyday life of the palpitations and the shaky hands, the anxiety settles out. Because I'm sure you can imagine that is hard to live with. So on this slide here, just kind of talking about path forward. Basically what I had mentioned is just that coming to see me, and if you're new to my practice, the way that I work is I set everybody up with a no charge consult. It's an initial consult where we'll talk about your symptoms, talk about your goals, see if functional medicine is a good fit for you. And from there, I would go ahead and order some testing. I usually start with basic testing just to see where we're at. So we do a blood panel. Do a review together just to kind of see, where we're at, what next testing we might need. We talk about, root cause. Again, we're going to look at, with that blood panel, I'm not just going to test your thyroid, I'm going to test your nutrient levels. I'm going to test some inflammation markers, things like that. And so there can be some real clues in that blood testing that show us what to do next. Sometimes that's going to lead to advanced testing, some gut health testing, some other things that we look at as far as allergy, that sort of thing. And then what we'll do is create what we call a personalized protocol, but basically based on your results, what is it that you need personally to make you feel better? Is certainly not a one size fits all. And then, of course, doing regular monitoring check-ins and kind of adjusting what you're on and what you need in order to give you the energy back and to calm down some of the symptoms you had come to see me with. So that is a really quick version of how your thyroid works, what can happen when it's not regulated correctly, and what we look at when you present with those symptoms. So I guess at this point, I am going to stop talking, and I will give you back to Tim here so that he can kind of walk you through next steps if you're interested in checking out your thyroid health.
Thank you, Jen, for all the clinical knowledge that you're delivering to us today. Yeah, so next step. So if you're watching this on our YouTube channel, on our website, wherever you're watching this recorded after the fact, you could always scan the QR code there, which takes you directly to our booking page to book one of those 30-minute, no cost, no charge consultations. And again, if it's something totally not thyroid related, maybe it's a sleep issue, maybe you've got a child with ADHD symptoms, maybe it's something completely random that you're dealing with from a symptom perspective that's just not been addressed by traditional medicine, feel free to use that QR code, book a link. Jen will get with you and just determine based on that free consult whether functional medicine is a fit, right? Not every situation would be a fit, right? So if you need 10 stitches in your arm, you got to go to urgent care for that, right? Functional medicine's not going to help you with that. It's more of those long-term symptoms that go unresolved, typically for years, and like Jen mentioned, can eventually turn into bigger disease processes, right? So if you don't fix these thyroid things and you end up with Graves' disease, right? You damage the thyroid, or you don't address pre-diabetes symptoms, you end up diabetic, right? And so traditional medicine just kind of waits until you're there, and then they want to hand you a pill, right? So if we can address root causes early, whether it be leaky gut or hormone health or whatever the case may be, you can kind of nip that stuff in the bud on the front end. So with that, I will open it up for any questions. Feel free to throw anything in the chat, or you can unmute yourself and ask any questions. While we're waiting for that, I will ask a question that popped in my head, Jen, that might be helpful for our audience, even if they're watching this in a recorded version. Now I got to remember what my question was. Is it very common? I know you mentioned typical traditional medicine, they will not check all of those other labs. And I was going to mention, if you've had recent lab results, we do have a program that you can sign up for on our website called a it's kind of just a
Lab
evaluation of,
launch.
yeah, it's a lab launch basically. uh it has a different name, but it's a simple review with Jen. It's very inexpensive. I think it's on the website right now for $59. But basically, she can take existing labs that you've had done, and she can review those from a functional medicine perspective. So I don't know if you want to just um, talk about that real quick.
Sure. Yeah. That can be another way to kind of dip your toe in the water of functional medicine and see. So when I was talking earlier about how the parameters are so much different. So again, traditional medicine, we're going to have a much wider parameter of what is normal. Functional medicine is going to be much more narrow. So if you've had recent lab work done, whether it's thyroid lab work or something else, and you would just like a functional medicine take on, here's what my numbers said this year. What do you think? That is super easy to do. And like Tim mentioned, it's $59 visit, and you would just forward your labs to me through my EMR. I would take a look at it. We'd get on a telehealth, whether that's a video call or over the phone, and we could talk through what that lab work is saying and recommendations for future testing. And sometimes that's going to lead to you becoming a patient for me, and we start doing some of that testing. Sometimes that's going to lead to, hey, this is the next test I recommend, and you can go to your primary care and ask for that testing. And some people have primary care that will do what they want them to do sometimes, and we'll do that testing. A lot of times, primary care is bound by insurance, and I know because I worked it for years, and you can't just justify extra testing. So in those cases, it's great that I am not bound by insurance, and so we can step into doing that testing. And what I explain to a lot of people is that I get wholesale prices on labs, and so it's not as expensive as you would think if we're doing some further lab testing, outside of using insurance.
Yeah, thanks, Jen. That's a great point. Yeah, because I mean, it is possible that your primary care did run a T3 to T4, and you know, what are those levels as compared to what they should be optimally? So that can be very helpful. I think, unless you had anything else to add, Jen, I think we are done.
Yeah, I'm good. I just thank y'all for listening. I know I can get kind of wordy, and it's hard to take something complex and make it like a brief overview. So please know that you can message us through either the website, there's a contact us, or you can email directly, jen@rootedclinicalwellness.com, if you have any further questions. And then I did want to note too, I realized with this webinar, anybody could see it, but I am actually licensed to see patients in the state of Tennessee. So we do have to follow the licensure rules. So I'm sorry if you're not in the state, but I still think it's valuable information, because that way you can take this knowledge and go back to your primary care. Or if you're interested in functional medicine from in another state, if you wanted to hit me up for referrals, I have several that I know in other states, and I can certainly send you their direction.
Yeah.
But thank you so much.
Thanks, everybody. Have a good one. Bye-bye.